Good afternoon and welcome to our webinar series focused on bringing you information about COVID-19, infection control, and other nursing home related topics. The information in this web series is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. My name is Laurie Jones and I'm a communication specialist here at Quality Insights. Today's webinar is Influenza and Source Control in Nursing Homes. Everyone has entered the session today on mute, but we will have a Q&A following the presentation. If you have any questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinar series. Next week's webinar topic is minimum data set changes are coming. If you're interested in joining us, that webinar will be at the same time and same place at 2 o'clock next Wednesday. And now I'd like to introduce you to our guest speakers today. It's Heather Hoffman and Cindy Holmes. Heather Hoffman is a Washington State transplant who now resides here in Southern West Virginia. Heather has over 15 years of clinical healthcare experience and has been with the West Virginia Department of Health for over 3 years. Heather previously functioned as West Virginia's lead case manager for the Ryan White program that provides and coordinates services for HIV-infected populations. She recently accepted the role as vaccine program manager for the state of West Virginia as of February 2024. Also joining us today is Cindy Holmes. Cindy is a registered nurse with over 40 years of experience. Her work experience includes direct patient care in various settings in acute care hospitals and director of surgical services. Cindy has also worked as a consultant preparing hospitals for regulatory surveys. Her last position in the acute care setting was as Director of Quality Management, Infection Prevention in a long-term acute care hospital. Cindy is currently the National Health Safety Network epidemiologist for the West Virginia Department of Health, Bureau of Public Health Office of Epidemiology and Prevention Services. She is responsible for the analysis of infection control assessment data, as well as the data from National Healthcare Safety Network for the West Virginia and a variety of healthcare facilities, including hospitals and long-term care facilities. So thank you, Heather and Cindy, for joining us today. I will now hand over the presentation to Heather.
As you said, my name is Heather Hoffman. I'm the vaccine program manager for the state of West Virginia. I oversee all of our 317 funds and our VFC program for children, and then our adult vaccines safety nets at all of our local health departments. I have been with the Bureau for a little over 3 years now. And like I said, or like she had said, actually, I've worked in healthcare in some capacity my entire life. So yeah, next slide, please. So we're just going to go over some basic flu facts. I'm sure everybody's very familiar with influenza, but we'll just go over some basics at first. So some people don't realize influenza can be detected year-round, but it is most typical during fall and winter, which is considered respiratory season. Most often flu begins in October and peaks between December and February, but February is the peak month out of the entire respiratory season. During flu season, many other respiratory illnesses spread that mimic the flu, such as rhinovirus, which is the common cold, RSV, COVID, pneumonia, etc. Depending on individuals' climate, actually can determine when respiratory season begins. So if you live in a more tropical area like Southern Florida, for instance, that may actually adjust when your respiratory begins and ends. It can vary depending on geographic location and weather. Annually, the percentage of flu diagnosis in the US is between 3 and 11%, which is just over 1 million people. And that's just confirmed diagnosis. It's not actual flu cases. And then persons are most contagious within the first 3 days of infections. So we always encourage everybody to get tested as soon as they have onset of symptoms, just to confirm, and then confirm that they do in fact have the flu, and then prevent transmission. Next slide. Okay, so this graph shows flu activity throughout the US from 1982 up until 2022. So the CDC functions 2 years behind. So what it actually shows, it shows the peak months during respiratory season for the last several years. As I said before, February is the peak for the entire season with the most cases confirmed, and they've had 17 seasons total. Following that would be December with 7 seasons, and then January with 6 seasons. Next slide. Basic things to know, to remember: flu vaccines prevented 6.2 million cases, which is roughly the population of Philadelphia. The flu has caused 45 million cases, 810,000 hospital stays, but the flu vaccines prevented 91,000 hospital stays. It's caused 61,000 deaths and prevented 5,700 deaths. Next slide, please. Most importantly, too, flu vax for those with chronic conditions. So roughly 6 to 10% are more likely to suffer a heart attack within the first 3 to 7 days after getting the flu. They're roughly 8 times more likely to suffer a first stroke in the first 3 days after getting the flu. People with diabetes who get sick with the flu have 3 times the risk of hospitalizations and 4 times the risk of ICU admission and 2 times the risk of death. And then people with various lung disease who get sick with the flu are at risk for asthma attacks, COPD flare-ups, and pneumonia. Next slide. So if you're unaware, the CDC has a really neat tool, which I will drop in the chat at the end. It's called FluView. It's operated a week behind, and it has current data for the entire United States. So it shows you how many cases we have, how many cases and how many positive tests that's been confirmed, and it's active and live, so you can view exactly where we're at within the flu season and in which areas, and it can get down to specific locations and states, and it's a really neat tool that I would encourage everybody to look at, and that can monitor and provide information throughout the entire respiratory season. Next slide. So easy tips for prevention. I think we all learned with COVID all about social distancing, but the same still applies with any respiratory illness. So definitely, if you are experiencing symptoms, if you have or have not tested positive for flu, social distancing is always advised. Of course, covering coughs and sneezes, frequent hand washing, as well as hand sanitizing, maintaining clean and fresh airflow. So if you're in a home where somebody has tested positive or an environment where somebody has tested positive, make sure that we're not leaving everything locked up and buttoned up. We want to get fresh air in and out, sanitized surfaces and things like that. And then most importantly, encouraging to get your seasonal flu vaccine as soon as possible, which are currently all available now. Next slide. Okay, something that the CDC has done a lot of research on, especially with COVID and vaccine hesitancy that we've all really faced since COVID. A lot of people are very hesitant on any vaccine at this point, whether it's new, old. So it's been a very controversial topic. What they have found is that trusted messengers seems to really help people in our community, outside of healthcare professionals, outside of your normal PCP, family doctor, but people like friends and family, dentists, your pastor, our congregation, teachers, counselors, and even your barber or hairdresser. Actually, New Mexico did a really interesting research project with the CDC called Chair Care, and they had a host of barbers and hairdressers that trained specifically on COVID-19 vaccination, all the actual facts and misinformation, and then would offer that education when they had their clients come in. It was really successful and well sought. And then also research has shown people with shared experiences. So those who may have suffered loss or those who may have been affected personally by somebody diagnosed with the flu or a respiratory illness. Those are the most impactful ways that studies have shown to reach our community with vaccine hesitancy. Next slide. So this is going to be a video, again, about a trusted messenger. So somebody who is personally affected by somebody diagnosed with the flu and how it's impacted their life.
My sister, Marcelina, she was a very important person in my life. She was like a mother to me. She's always told me that I can be anything, do anything, never say I can't, always say I can. Marcelina didn't expect us for Christmas. But when I got there, she looked horrible. She looked really horrible. She looked like pale and looked white like a sheet. And I kept telling her again, you need to go to the hospital. You need to get help. Marcelina was in the hospital for 3 weeks. She was put in an induced coma, and they stated that she had pneumonia at first. And after that, they explained to us that she had the flu. They didn't describe what flu it was until later on, and she ended up passing away with her heart stopped and her lungs gave out. It's important that the communities and globally worldwide get vaccine because vaccine does save lives. Every age needs to get vaccinated. I became an advocate for vaccinate your family, and I am going to continue being an advocate for the flu each and every day to honor my sister's legacy. Your children have a bright future, and if you want your children to have a bright future and be healthy, you get their vaccine so they can live their life to the fullest.
Okay. So hopefully that kicked back over. Perfect. Okay. So like I said, the CDC, they've done a lot of research on this. The best way to combat vaccine hesitancy has been shown to be those trusted messengers. So advocate for yourself, for your family, for your friends, for your community, and provide current and correct information to combat misinformation. And that's it for me. I'll give it away to Cindy, but if anybody has any questions or would like additional resources, feel free to reach out at any time. And then I will drop some links in the chat for FluView and different information.
Okay, can everybody hear me?
Yep.
Okay, we're going to spend a little bit of time on source control. This slide presentation is from Project Firstline, which is a branch of CDC training collaborative. If you all have heard me speak anytime before, we use Project Firstline a lot. It is free. It has pre-recorded, pre-made slides that you can use to educate your staff. So this is one of their presentations. I will tell you, this was developed during COVID, so a lot of the language is COVID, but it absolutely is pertinent and pertains to respiratory illnesses during this this season. Next slide. So what we're going to do is we're going to explain how source control keeps germs from spreading. you should be able to discuss at least one reason why source control is for COVID and other respiratory illnesses like flu and RSV, why they focus on masking. Next slide. So one of the definitions, source control, again, not just for COVID, respiratory illnesses, is use of well-fitting cloth mask, face mask, or respirators to cover a person's nose and mouth to prevent the spread of respiratory secretions when they are breathing, talking, sneezing, or coughing. And next, we're going to watch a brief video, again from Project Firstline. It's Dr. Abby Carlson, who did a whole series of little short videos covering everything infection prevention. There's like 20 different episodes. So this is the one she does on source control.
Welcome back, everyone, to Inside Infection Control, our video series here at CDC's Project Firstline. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you with us. We have talked in previous episodes a lot about the different actions that we can take to keep germs from spreading, in healthcare in particular. And source control is one of those important actions. But what exactly is source control? It's a concept that we come back to a lot because it's that important, and it starts, not surprisingly, just like its name, at the source. You're stopping germs at the source before they can spread to other people. We talk about source control as an important tool for COVID-19 to reduce the spread of COVID-19 and other diseases that travel in respiratory droplets. And we're going to focus on that today. But keep in mind, source control is important for a lot of other diseases too. One example is shingles. We cover the spot where a shingles rash is, which keeps virus from getting from the rash into the air or onto other surfaces in your environment where it can spread and it can infect people. That's source control for shingles, covering the rash, the source. In COVID-19, source control focuses on covering the nose and mouth to keep your respiratory droplets out of the air, because that is the main way that the virus that causes COVID-19, SARS-CoV-2, gets from person to person. Masks that fit snugly around the cheeks and our chin are the main way to do source control for COVID-19. A mask that fits well covers your nose and your mouth and blocks those respiratory droplets, which are traveling in the air when you breathe and which have virus in them if you're infected. This means that those droplets, when they're covered up with that mask, are much less likely to reach other people around you and then infect them. And if you're caring for a patient with COVID-19 and you're using an N95 respirator and not a mask, most N95 respirators that we use in healthcare are also good at blocking your respiratory droplets from breathing out into the air. So with most N95s, not only are you protected from the virus that your patient is breathing out, but your patients and your colleagues, if you're infected with any virus, are protected from germs that you might breathe out. All of this source control is important for COVID-19 because we don't always know who's infected. Other source control methods, like in the shingles example, depend on knowing that the patient is infected and knowing what to do. For example, covering a wound because you've seen it, you know it's there. COVID-19 is different because we have patients who are asymptomatic, which means they can be infected, but they may not show it yet, and we may not be aware that they or we, if we're infected, can spread the virus to others by talking, breathing, singing, and other activities that use our breath. We'll talk more about this in another episode, so please stay tuned for that, because asymptomatic transmission, asymptomatic infection, it's an important thing. But this spreading of infection when you don't have symptoms, it's one of the biggest reasons we have everyone wear a mask that fits well when they're in the healthcare setting and also when you're out in the community. So you can see why source control is an important tool in healthcare and in the community for stopping the spread of COVID-19 and other diseases that travel by respiratory droplets. As always, thanks for joining us. Please be sure to follow up with us on Facebook, on Twitter, we're on YouTube, and of course we're on the web, cdc.gov/Project Firstline. We will see you back here for the next episode.
So what I like about Dr. Carlson's definition is it's kind of simple and to the point, but it really explains that source control is about stopping the germs at their source before they can spread. So again, covering your nose and mouth with a mask to keep your respiratory droplets out of the air. And again, like she stated, this is because your respiratory viruses, including COVID-19, travel between people through respiratory droplets that then, when the infected person talks or breathes or otherwise blows out air out of their nose or mouth. Next slide. Again, a big thing is we don't always know who's infected with COVID or RSV or the flu. They may not have any symptoms yet, and they can still spread the virus to others through respiratory droplets, which is the source control, why the source control for these illnesses is so important. Next slide. Again, it's very simple. How can masks stop germs at the source? It's by covering the nose and mouth, prevents the droplets from getting into the air and therefore keeps them from spreading to others. Next slide. So, some tips: wearing a mask, make sure it fits snugly around the cheeks and chin without gaps at the edges. As you can see in these pictures, the right way with the check and the wrong way with the X. And I just like to show normally what I used to see when I was in the acute care facilities is we saw this. Can you all see? Under the nose. Not correct. Not correct. Next slide. N95s provide a little more protection. They protect you from breathing respiratory droplets, and also most of them prevent droplets from being breathed out into the air. Next slide. Just some key takeaways. Again, source control keeps the germs from spreading them by stopping them at the source and not spread to other people. Source control is an important tool to reduce the spread of COVID-19 and other respiratory illnesses. For respiratory illnesses, source control focuses on covering your nose and mouth with a mask to keep the respiratory droplets out of the air. Most N95 respirators used in healthcare not only protect you from the virus that your patient is breathing out, but also protect your patients and your colleagues from germs that you might be breathing out. I'm going to put several links in the chat that are very helpful. They're all CDC and Project Firstline. There's the CDC respiratory illness website that has lots of information, lots of recommendations. Inside that website, which I'll also put in the chat, is the respiratory illness data channel, which tells you sort of like what Heather was saying for the flu view. It gives you, it's updated weekly, and as of August 30th, respiratory illnesses throughout the country were at a low, but COVID-19 was elevated nationally. And like I said, they update that weekly. And then there's also a CDC mask and respiratory viruses prevention website that talks more about masking. And then the Project Firstline infection control guidance respiratory viruses. And I will drop those in the chat. If y'all have any questions.
All right. Well, thank you, Cindy and Heather. In a moment, we will begin the Q&A portion of the session. If you have any questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. You can also raise your hand to request to be unmuted to ask your question out loud. I'd again like to invite everyone to next week's webinar, which is about minimum data set changes. That will be at the same time and same place next Wednesday at 2 p.m. We also invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon. You can find the links to those live chats and our webinars in our weekly e-newsletter. It's sent out every Friday and it's called the Last Minute Lowdown. If you would like to receive that newsletter but don't think you're currently on our list, please email Kathy Caudill, and that's CCAUDILL@qualityinsights.org, and she will get you on the list. All right, so we'll just go ahead and look and see if we've had any questions submitted. Someone asked about sharing your presentation. Can you share the sources for the fact sheets you had in the beginning of your presentation? And that's for Heather.
Yeah, absolutely. Do you prefer if I send it to you to send out, or do you want me to just pop it? I popped the links in the chat, but presentation wise, how would you like to accomplish?
Yeah, I'm going to go ahead and email everybody a copy of the slide deck,
Okay.
a link to the recording. Anybody who attended today and anyone who registered, we'll get that out to everybody later today.
Excellent.
All right. Pause a second, just give everybody a chance to type in questions if they have them. All right, well, I'm not seeing any questions, so I guess we'll go ahead and wrap everything up. Just wanted to thank everyone again for joining us today, and thanks again to Heather and Cindy for being our guest presenters. Before we sign off, I'd like to ask everyone to please answer a very short evaluation of today's session. The evaluation is anonymous. It will show up as a pop-up as soon as you close out of the webinar. If you have a couple of minutes to fill that out, we'd really appreciate it. Heather and Cindy, thanks again. Thanks everyone for attending. Hope you have a great rest of the day. And this now concludes the session.
Thank you. Bye.
Bye-bye.